Hi, my name is Arielle Creager. I am a prenatal and postpartum personal training specialist, and today I will be discussing the 8 most common aches, pains, and complaints in pregnancy. Number 1, low back pain. It is a very common ache in the low back, lower spine area due to shifts in your posture, growing belly, and muscle imbalances. It happens a lot because of our center of gravity shift. So we are shifting, we usually lean back a little bit to counteract that center of gravity shift, and all that pressure is going into your low back. To manage or prevent low back pain, which is often about managing because it happens so often, you want to have neutral alignment. That is your ears over your shoulders, over your ribs, hips, knees, and ankles. Right? This is very common. A lot of tech neck going on these days. I also recommend strengthening your core, your glutes, and incorporating gentle stretches like cat-cow or kneeling hip flexor stretches. And I always encourage my clients to keep moving, regular movement, and also underrated, wear supportive footwear. It is also important to be cautious of exercises that put more pressure in your low back, like a deadlift, a lot of core exercises. So regressing moves, taking it back a notch if you feel your low back being over involved. Number 2, diastasis recti. It happens to 65 to 85% of all women to varying degrees. I've heard some things that it's 100%. But there are 2 main things you're looking at: width and depth. And it occurs when your linea alba, the fascia in between the 2 sides of your more superficial abs, it becomes weak. You can see coning or doming, and that is your cue to pause what you are doing, regress it, or just cut it for the time being. What helps this separation is 360 breathing, pelvic floor activations, which I have other videos about, and core exercises that strengthen your core without putting too much intra-abdominal pressure. Also important, maintaining neutral alignment. In general, you want to avoid behaviors and exercises that spike your intra-abdominal pressure, like breath holding, and avoiding crunches, twisting, plank exercises, anything that puts too much pressure and your core can't handle it. Third is pelvic floor dysfunction. It is a weakness or dysfunction of the pelvic floor muscles. There are 14 muscles. It is a sling at the base of your pelvic area, and cues that you're having some issues is leaking, urinary incontinence, or feeling of heaviness and pressure in your pelvic region. To manage or possibly prevent pelvic floor dysfunction, it's important to work through a full range of motion in any pelvic floor exercise or activations. You don't want to just tighten, you want to also be able to relax. It's not a Kegel. You want to feel all 4 points of connection, relax, and activate. Neutral alignment, core strength are also going to be your friends with pelvic floor dysfunction. Make sure you are focusing on breathing techniques that help manage pressure, not increase it, like what I already mentioned, breath holding, sucking in, anything that increases your pressure downward on your pelvic floor. Number 4, your SI joint, your sacroiliac joint. SI joint dysfunction, it's pain in the back of your pelvis, often on one side, and worsened with unilateral. That means one side movement. So walking, climbing stairs, single leg weight bearing exercises like a good old single leg deadlift or a lunge. To manage or prevent SI joint dysfunction and pain, it's important, well, yes, core strength, neutral alignment, but it's also important to emphasize bilateral strength moves. So that means squat, keeping both legs down on the ground. Both legs are doing the same thing. It's also important to strengthen your glutes. While you're having an SI joint flare, avoid lunges, step-ups, any single leg exercises, or really deep stretches like a pigeon pose, sitting cross-legged, high-impact jumping, bouncing movements until that pain improves. Number 5, sciatica. Sciatica can be radiating pain from all the way up in your back down to your foot. It can be very uncomfortable and painful, and it's often caused by spinal misalignment or piriformis issues, glute issues. It is often worsened by prolonged periods of sitting. So what can you do? You can strengthen your glutes. You can improve your posture and alignments, gentle glute and hip mobility work, gentle stretches to relieve pressure, cat-cow. There's exercises you can look up for nerve flossing, anything that can open up through your hips and so you can find relief up here or wherever you are feeling that radiating pain. Number 6, pubic symphysis dysfunction, or SPD. There is a joint between the 2 sides of your pelvis that can get loosened due to the hormone relaxin that is there to help promote an easier labor. But sometimes there can be a little bit of laxity between those two sides of the pelvis, causing acute pain, sharp, wrenching pain in the center of your pelvis. How to manage or prevent it? Mainly keeping your legs together. You're going to be avoiding a lot of unilateral things, such as a side lunge, maybe a deep reverse lunge, anything that separates your legs and pulls the sides of your pelvis apart. Strengthen your glutes, avoid high impact exercise, really focus on pelvic stability, and maintain neutral alignment and core strength. Additionally, any sudden twisting or pulling motions may aggravate it as well, so highly recommend avoiding those. Number 7 is round ligament pain. Very common. You have a ligament that connects to your uterus, goes down, and as your belly expands, it can be really taut and uncomfortable and painful. Sharp movements can aggravate it. What can help it is moving slowly when you change positions, like going into a bedroll when you're getting out of bed, and maintaining neutral alignment and control through your movements. Avoiding jerky or fast transitions, and preparing for a sneeze or a cough with a hinge without bracing. And then we have carpal tunnel syndrome, number 8. That is numbness or tingling in the hands or wrists due to nerve compression. It's often from swelling, so if you have edema, especially later in pregnancy, it can cause carpal tunnel syndrome and pain right here. Managing or preventing it involves focusing on posture, especially right up here, encouraging hydration, and modifying any movements that might aggravate it, such as a high plank. Also, using a soft brace that keeps your wrists aligned, super helpful. Make sure to consult a professional about any of these aches or pains. Reach out to me with any questions, and make sure you check out my programs that help support you through motherhood.